Now, at the time that the country is facing some challenges, and when I'm talking of the challenges, I'm not talking of the challenges that you people may be thinking of. I'm talking of the challenges that we are facing in the immunization program in the country. We are all aware of the cholera, but I don't know how many in the room are also aware of the circulating vaccine-derived polio virus that have been circulating in the country, that started from Western Equatoria and is not yet now declared closed. As I'm standing here, I have the opportunity of just reading the EP Week 16 of how our immunization program is performing. And one thing I underline is that the active search done by the people who are supposed to be doing the work to the facilities has dropped by 300%. So I wrote immediately, and the API manager is in the room, and the DG for primary healthcare is in the room. If we cannot go to do the active search, then is it really a time for us to introduce new vaccines? And the reason I'm doing that is that I had the opportunity to represent my country when we were still part of EMRO. So you can imagine how far that was. And in that room, and I quote, I got the opportunity of meeting a lady from Gabi. And she said, by then I was not a professor, she said, Dr. Rose, you did a very excellent presentation. By then we were talking of not the sustainable, but the millennium, the MDGs. And we in South Sudan, we were on track better than Sudan on the Millennium Development Goal. Our API coverage was standing at 75 going to 80. We were better than countries that were there before us. Now I don't want to say the figures because the API manager is in the room and will tell us what the figures are looking like. So she told me, we as Gavi, we will be ready to support you to make sure that new vaccines are introduced. Among them was Pneumovax and Rota. And that's why, although I was not invited, I invited myself into the room. Because from that day, we started that discussion of having the rotavirus and the pneumovax introduced in this country. From there came up the issue of co-financing after some times, and that's when it belongs to the Ministry of Health. And my question to the Ministry of Health, I hope we are doing well in co-financing, because if we are just talking of what the partners will be doing in terms of whatsoever they are doing, and we are not taking our role as the government, and I'm part of the government, to talk about the co-financing and what we are doing in co-financing, we will be wasting our time sitting in this room. And that one is for also the SWIM to take note of. My second message is to SWIM, and allow me to quote that. And on another capacity that I was a mentor, two people in this room happen to be mentees from that group. And if they are in the room, I would like them to stand up. I don't want to mention names. Emily, you can stand up. Bushai, you can also stand up. If there's anybody else who was a mentee, I was a mentor in that group, please stand up. These are the two I know from South Sudan. The third is the first gynecologist. She's not with us, she's in Kenya. So these were the three. And giving out the message to all the women in this room from SWIM that when the second opening for that program starts, please apply. I remember Emily gave us the opportunity to apply last time and nobody applied. Please apply and you will see the difference that it will give you. Please sit down. Emily will tell you later on what is that program. The last message is to the females in the room. Can the females in the room all stand up? Those who are biologically